surgery, and it's hump day +1. Yes, all right. So I know it's not actually hump day. We got a little backed up yesterday. Had a lot of great, terrific surgeries. Got just a little bit busy, and we were not able to do it yesterday. But here we are. So we are ready for hump day +1. And of course, we're going to take some time to answer all the questions. But I wanted to start off today talking about perhaps something a little bit different. I wanted to talk about facial rejuvenation. Okay, about the kind of different things that we can do with the face to make the face appear younger. Okay, and really there's many options that we can do, and I like to kind of categorize them in terms of invasiveness. Okay, so there's things that I would call minimally invasive or really not invasive, and then we can go to what I would call moderately invasive, and then to what's fully invasive, which is now we're talking about surgery. And so I kind of created a little chart here. I hope that you all can kind of see that and read that. And so it really goes through a lot of the options that we have to rejuvenate the face. Okay, and as you can see here where it says invasive, so I'm going from least invasive to most invasive down here, so that people kind of understand what all their options are and kind of really what type of a commitment they have to do in terms of risks, benefits, and recovery. Okay, so what's been happening over time is that we've kind of trying shifting towards like either the non-invasive or moderately invasive procedures, and kind of shying away from like the more invasive procedures, and then starting these procedures earlier, so that there's kind of more of a maintenance to the face and less aging overall as time goes by. Now, there's one thing that I do want to mention that's really important before we get into all this, is that the best thing that you can do for your face is actually not even on this list, because it's something that doesn't require a plastic surgeon. The best thing that anyone can do for their face is not smoke, okay? Don't take too much sun. In other words, wear lots of sunblock, okay? And stay very hydrated. So if you stay hydrated all the time, you're not smoking, and you're not too exposed to the sun, that will keep your face young much longer for many more years to come. Okay, but people that are smokers, that are in the sun all the time, that are dehydrated all the time, that don't use the moisturizing lotions, those are the faces that tend to have a lot of rhytids, a lot of wrinkles, and then they look older than their actual age due to all those things. And it's really hard, difficult to reverse, even with all these modalities and all these options that we have here today. Okay, all right, so let's get started. So I would say kind of like the non-invasive or minimally invasive, kind of at the top of the ladder here, we have your injectables. Okay, and so that is basically your neuromodulators, which are Botox, and your fillers. Okay, so what does Botox do? Botox paralyzes muscles. It's best used for the glabella, which is in here, for the forehead, and for what they call the crow's feet in this area. So I would say Botox is really the best for the upper face. Okay, the other thing about Botox is if you apply it correctly, you can get a certain degree of a brow lift with the Botox, and for that reason the surgical brow lift is really not done that often anymore, like it used to be before Botox came around. Okay, and the other thing is the fillers. There's multiple different fillers out there, multiple brand names. Most of them really based on hyaluronic acid. At least those are the ones that I use, because although they last about 6 months or so, they're reversible. So if anything were to happen, or someone has a sudden allergy, or they don't like something, or too much was placed, you can actually reverse it with a little injection as well. So those are the ones that I like to use. Of course, there are some people, I wouldn't call that it's not going to be in this category, but sometimes you can use fat in terms of fillers, but now you're talking kind of a mid-level category there. We're doing a little bit of lipo and then injecting the fat into the areas, and that is permanent. So if you don't like it, you're kind of stuck with it. So I personally like to use the fillers, and that's mostly for the nasolabial folds, which are these right here, marionette lines that are down here, to fill the lips if we need to. And sometimes you can actually create volume to the face, kind of to the mid-face area, or kind of the upper cheek area in layman's terms.
Will the wrinkles be worse after the Botox and fillers wear off?
No, they definitely won't be worse. Actually, they're potentially over time, will be better. So there is kind of a little bit of a movement now, and I was alluding to this a little bit before, but there's what is called baby Botox. I'm not sure who came up with the name. I think it's a little bit of a silly name, but what it means is that you start using Botox much younger. You start using it, say, when you're like 30 years old, okay? And at that point, of course, you don't need as many units as someone who, say, is 50 years old. So you start using just a little bit of Botox around that time, so that there's not so much contraction of the muscles over time, and therefore you develop less wrinkles as you grow older. So I think baby Botox actually works, and it's kind of something that you can add as part of the maintenance to the youthfulness of your face. Okay, all right. So those are the injectables there. Okay, so the next step is using several kind of energy type devices. Okay, so for a long time it was mostly the lasers. Okay, so there's different lasers that you can use to the face. One of the most common ones was what's called a CO2 or carbon dioxide laser. That's used for skin resurfacing. It's not really kind of one of these, lunchtime type procedures. For a true CO2 laser is something that requires almost about a week of downtime, okay? But it does, it's basically a controlled burn of the face, really, that's what it is, a controlled superficial burn. And so, the kind of overlying skin eventually starts to slough off, and then what's left behind is much smoother, much nicer skin, okay? Even before lasers, people were doing what's called chemical peels. The really strong chemical peels are not as popular anymore these days, because if you don't do it correctly, it can cause serious issues. But there are some kind of very light chemical peels that are still done, and that could help as well. But what we have here, which I think is really cool, is the microneedling with RF or radio frequency energy, and that's what we call the Morpheus. Let's see. That's basically their thing here, so it's called Morpheus or Morpheus 8 here by InMode. And you can see a couple examples here of different patients that have used it. But it's microneedling. And let me see here. So this is what the kind of the box looks like. Morpheus 8, you see there, microneedling RF energy. And this is what the head of the device looks like there. All right. And it's probably going to be very difficult to see into the camera there, but as you can see, it has 24 little needles in there, and each of those needles is able to deliver a set amount of radio frequency energy, okay? And what that does is that it basically creates a controlled inflammatory reaction to the skin, and the skin therefore is able to contract and look much smoother, much nicer, and it helps with like a lot of especially the fine lines and wrinkles that people can often have to the face. Now the Morpheus is a little bit of a commitment in the sense that it requires at least 3 treatments, okay? So you need at least 3 treatments spread 1 month apart. So if you're going to buy into the Morpheus, which I think is a great tool, a great solution, it is one of these kind of like lunchtime type procedures. You need to do 3 treatments to really get the results that you're looking for. Okay, and then just a little bit more than that, we have it kind of falls. These categories kind of come together, but you have the face tight with or without lipo as kind of the next step in the invasive ladder here. So, what is face tight and AccuTight? So it's very similar in terms of in the sense that it's the same machine, the Morpheus. It uses radio frequency energy, but this time you're using a probe. So I don't know if you guys saw on the Pure Instagram, they saw me using, I was using here the FaceTight, which is this probe right here. And as you can see, it's about that long. It's about that long of a probe there. Of course, it comes with one-time use in a sterile package, which is why we have that here. And that works really well for the chin and neck area, and sometimes along the jawline here a little bit as well. Okay, so that works excellent. Works very well for those areas.
How do you know if you need a neck lift or lipo for the neck? Or
right, so that's a great question. So basically, it really depends on like how loose the skin is. Okay, so if the skin is very loose, like you really have that kind of turkey gobble thing hanging fairly low because of, usually the reason is massive weight loss. Then for those patients, typically, anything that's not in the kind of surgical level, it's not really going to give you the results that you need. Now, if you have, modest or moderate amounts of loose skin, you do have some fat to the area, then a combination of the lipo chin neck with the face type to the chin neck will be the perfect procedure for you. And of course, you avoid the big surgery, you avoid all the, the long scars along the ear as well. And then the other kind of handpiece that we have is what's called the AccuTite. Okay, so I'll show that one there. So it looks similar to the face type, except it's shorter and a bit smaller. Okay, because this is the one that we're using for kind of a little bit more sensitive areas. So that you use, kind of in the upper cheek, lower lid area is a possibility there to help with the lower eyelids. And I've seen some surgeons do it. I got to take, I think, a little bit more courses in this, but I've seen some surgeons do it along the nasolabial folds as well. So I'm not offering that just yet, but hopefully in the near future we'll see if we can offer that as well. Okay, and then especially for the chin neck area, a lot of the times you combine the face type with the liposuction. So the face type takes care of the skin, the liposuction takes care of the excess fat, and that way you're able to really rejuvenate this entire area without needing a long surgery under general anesthesia. Okay, all right, and then if now we then get into like the really kind of the surgical treatments of the face, and if you're going kind of from top to bottom, usually the one on the top would be the brow lift, but like I said, not really done so often anymore because we can do a lot with the brow just using Botox basically, or if you're doing a bleph, you can sometimes do what's called a brow pexy just through that bleph incision, and not have to do those bigger incisions for the brow lift. And then for the eyes, or in and about the eyes, you can do your blepharoplasty. So you have your upper eyelid blepharoplasty, you have your lower eyelid blepharoplasty, and with the lower eyelid, sometimes you can do a little bit of a mid-face lift and kind of pick up the kind of cheek areas there as well. Okay, those are incisions that are right in the lids for that. And then of course you have your facelift. And that will really pick up the jowls, it'll rejuvenate the face, it'll improve the nasolabial folds. And with a facelift, you always essentially do a neck lift, improving the contours of the neck. Now this is a real surgery. I do it under general anesthesia, although some, and it does involve incisions that start kind of just in front of the ear and then around the ear and towards the back of the neck, in the back of the neck and the hairline there. Okay, so it's a great surgery, but typically done on patients that are older, probably in their 60s, that want to have maybe done some of the other things already, but now it's time for them to really go and rejuvenate the face and set the clock back about 10 years or so. Okay.
Hello, doctor.
Yeah.
I'm having lipo and a BBL with you in March.
All right.
The question is, I'm also having chin lipo with you, but would you recommend AccuTite over the chin lipo, or how would you determine?
So for the most part, and of course, I look at everyone's photos individually before we make recommendations. So I just want to make that clear, which is, I know sometimes we get complaints as to it takes us a while to get back to you with quotes and things like that, but I do want to kind of go over things so I can make sure that you're the right candidate, so that when you come to peer, and most people are coming from out of state in different places, that we don't have to completely change the plan or cancel surgery, God forbid, because of we made the wrong plan for you. So having all of that to say that I really have to look at your photos to know for sure, but in general, for the most part, I'm going to be recommending a combination of the face type plus the liposuction for best results in the chin and neck area. So after, you want to wait at least 3 to 4 months before then going ahead and doing the Molly makeover. You want to make sure you're completely healed from the BBL, and that you're doing well, and then you can go ahead and do the Molly makeover. So these are 2 separate procedures, so it's okay to do it within 3 to 4 months. Now that's different than kind of repeating the same procedure, meaning you had lipo 360 or BBL and you want to do lipo 360 or BBL again. For that, you want to wait a minimum. The absolute minimum is 9 months. If you can wait 12 months, even better.
Could you substitute BodyTite instead of a tummy tuck?
For it really no. I mean, it really depends on the patient. So patient selection is key, right? So if you have a significant amount of lower abdominal skin laxity, which means the skin is very very loose or wrinkly or a lot of stretch marks, okay, then you're still a better candidate for a tummy tuck, okay. Now, if all you have is just like a modest amount of loose skin, kind of below the belly button, what used to be kind of patients that the few the fewer patients that qualified for what was the mini tummy tuck. Now those patients, I think, instead of doing the mini tummy tuck, they can do some liposuction with body tight, and they will have a great result and avoid that mini tummy tuck scar. Which in the end is not that mini. It's actually, yes, it is shorter than a full tummy tuck scar, but it's longer than a C-section scar. So even though we call it a mini tummy tuck, it just means it's shorter than the full tummy tuck scar, but it's not that short overall.
So I have two questions. What are your thoughts on drainless tummy tucks, and does body tight require drains?
So body tight in and of itself does not require drains, but like I said, most of the time you're combining it with liposuction, and when I do liposuction of the abdomen and the flanks, I typically do use a drain in the lower abdominal area. Now, drainless tummy tucks, I personally, and this is a personal opinion, but I personally don't like to do them. When you do a drainless tummy tuck, the only reason that you can do a drainless is because you put several stitches on the inside called quilting sutures, okay, that stick the flap, you lift it up to do the tummy back down, okay? And so that takes a significant amount of time. That's one of the reasons I don't like to do it. And then the other reason is that if you're not very, very careful, you can create contour defects or little indentations and things like that in the tummy, which of course, the patient wouldn't be too happy with either. So for those two reasons, I don't do the drainless tummy tuck, but it is an option out there.
At age 61 with high blood pressure, would you be willing to do a tummy tuck at the hospital, or could you achieve that at your clinic?
Right, so yeah, if you're over 55, for a lot of the body procedures, we would most likely have to do that at the hospital, especially if you have some other, underlying comorbidities such as high blood pressure or diabetes. It would probably be best to do that in the hospital setting.
How do you recommend a BBL or mommy makeover first, or which goes first?
Yeah, so those two surgeries are combined quite often. Of course, they can't be done together. Especially here in Florida, when the state limits us to only 1 liter liposuction, when you're doing surgery such as the mommy makeover, you're really not going to get a lot of bang a buck for your BBL. So it's not, I know there's in some other countries like Colombia and perhaps the Dominican Republic, they do the whole thing at once. I honestly, even if it wasn't because of the Department of Health, I would not recommend it. I mean, that's a huge surgery. Each one of them is actually a big surgery. You're combining everything. The recovery is extremely tough. You don't know how to sit or lay because you can't be on your bottom and you can't be on your chest. Makes things very, very uncomfortable. And oftentimes, because it is such a big surgery, it's not unusual to need blood transfusions and things like that. So my recommendation is not to combine all those procedures. Okay, so you got to separate them out by 3 to 4 months. And which one goes first really depends on two things. One, patient desire, so what bothers them the most, okay? And two, it really has to do a lot with the amount of skin laxity in the abdomen. You have a true panic, so you went through massive weight loss, or you have multiple pregnancies, and the skin is really hanging low. For that patient, it's just best to do the tummy tuck first. Get rid of all that excess skin. You're not really going to lose a lot of fat, and that the people always worry about, well, where are you going to get the fat from? You're still going to have plenty of fat, okay? So don't worry about that, because that pannus, that piece of skin that we cut out, does not have that much fat there. It's not going to make a huge difference, okay? So for those patients, I would do the mommy makeover first, and then come back and do the BBL. Now, if the amount of skin that you have is not that loose, it's kind of moderate range, then yeah, for sure, go ahead and do the BBL first. If you're lucky and you do well, or perhaps if, your massages go well and everything else, and you have a good amount of skin retraction, it may be that you don't even need the tummy tuck at all. So for those types of patients, we would reverse the order.
What's the most cc's you'll inject for a BBL? And let's just say I'm having a BBL with you. Can I get fillers and Botox at the same time?
Okay,
So two questions.
Yeah.
So the most cc's you'll inject. Yep.
Right. So the maximum amount of supernatant fat. What does that mean? That means not all the fluid that comes out when we do liposuction, but once we separate the bloody fluid from the fat, that's called supernatant fat. And the maximum amount of supernatant fat that we can remove in Florida is 4 liters. Okay. So by definition, the maximum amount of fat that I can place into each cheek is 2 liters, right? Split that in half, 2 on one side, 2 on the other. That's the most that I can do. Can you do some fillers and Botox while you're here having your BBL? Yeah, of course we can do that. A lot of the times we can do it before surgery if you come with, say, a couple days of anticipation. So perhaps you want to plan to be here an extra day. Or sometimes you can do it, after surgery, before you go home. In which case, we still, for that brief moment that we're doing the procedures, we do have you sit in your BBL pillow, and then we're able to perform the procedures before you go. All right, everybody. Well, I think we've had a great discussion here. I hope this was very, very informative. Like I said, there's a lot of options for facial rejuvenation, but really each patient is unique. Each face is different, and so the best way to know what's the best plan for you is to come in or do a virtual consult or call us. All right, or all the ways you can that you have to get in touch with us so that I can take a look at you personally or take a look at your photos or videos, and then come up with a plan for you. Okay, so I hope everyone enjoyed this. We're looking forward to the next hump day next week, which should be on Wednesday as usual. But of course, if there's any changes, we'll let you guys know. Okay, I hope to see you all next week. Ciao.